Okay, let's finish this one up. I ended up with psychoanalysis. So please be aware of the insight therapies. Those two therapies we're going to talk about that are included as insight therapies are the psychoanalytic approach, which we talked about at the end of the last video, and the humanistic approach. Remember, the humanistic approach is more focused on the present, your conscious thought process. Well, the psychoanalytic approach is really focused on your unconscious mind and your past. The psychoanalytic approach is all about trying to resolve issues from your childhood, from your past, things that are going on in your unconscious, where the humanistic approach is more focused on the here and now and how do we get to be our best self. Okay, humanistic therapy, one of the key components of that is client-centered therapy, because it's not about the therapist I was going to say translating, like analyzing, explaining, interpreting what you're thinking. The humanistic therapy is all about, listening to you, reverberating back, like what you said, being very accepting of you. And I love this quote by Carl Rogers that really sums up the theory quite well. It is the client who knows what hurts, what directions to go, what problems are crucial, and what experiences have been deeply buried. So it's really about you as the individual going to that kind of therapy. Okay, behavior therapy then also often referred to as the learning approach. So behavior or learning, no, those are pretty much the same thing. You're applying the principles of learning. Think Pavlov, think Skinner, think Watson to really eliminate unwanted behavior. So these really work for things like phobias, things that you control. This isn't going to help heal schizophrenia or something like that, but it may help with other disorders, right? So counter conditioning is a big component of this. We're going to learn new responses to get rid of your unwanted behaviors. Okay, exposure therapy, this works really well with phobias. You might have flight simulation or, some kind of exposure therapy. You might use virtual reality in order to deal with that kind of therapy. Okay, systematic desensitization and aversive conditioning. I believe I have pictures. Yeah, so systematic desensitization, that's like if you had arachnophobia, you'd have look at a picture of a spider, bring it closer, hold a plastic spider, hold a dead spider, and then eventually hold a real spider. It's like a system, step by step, getting you kind of used to that anxiety and calm down. Aversive conditioning is really effective if you're dealing with something like alcoholism or people who bite their nails. You're going to pair something like vomit-inducing or nausea-inducing drug with that thing the behavior you don't want, so the alcoholism or something like that, drinking the alcohol. The problem with this is obviously people know that, yeah, the alcohol that they might drink in the office will have that nausea-inducing drug in it, but they know if they go to the bar around the corner, it's not going to have that drug, so it's not always long-lasting. Behavior therapy, remember my trapper keeper story, right? And the token economy. This is really good to modify behavior. I now know I will never slide on my knees ever. You get some kind of token or reward or even stickers or something like that. Cognitive therapy is all about your cognitive thought process. It's super effective with depression, kind of thinking in the here and now and how do we kind of resolve negative thought processes. No, Aaron Beck and Albert Ellis, they're known for their cognitive therapy. Aaron Beck does cognitive behavioral therapy. You guys can read these now or later, these descriptions, but they're cognitive therapists. We also have group and family therapies. These are really effective because they're much more low cost. If you went and saw a therapist one-on-one, it could get really expensive over time. Group therapy, you can kind of lay that cost out a bit, divide that cost up. So something like Alcoholics Anonymous, Narcotics Anonymous, any kind of support groups, because they are, it's more helpful to have people who understand you. Alternative therapies, trepanation, that's the drilling of the holes in the head, light exposure therapy, and eye movement desensitization. Biomedical therapies, this was, I think, the last thing we looked at in this unit. Remember, this is all about treating disorders with medicines, with surgery, drug treatment, psychotherapy is first, Drug treatment would come second, psychosurgery would come third, and that goes along with electric shock therapy as well. These are things that you don't want to do unless it's really, really, really necessary. You do want to know the difference between the different kinds of drugs. There are some multiple choice questions on the test that having you need to identify specific drugs and what category they fit in. Remember, classical antipsychotics get rid of the positive symptoms of schizophrenia, like hallucinations or delusions. And then the atypical antipsychotics, they are going to remove the negative symptoms of schizophrenia. Obviously, they have some side effects of kind of making you not feel, the way you want to feel, not feeling like a real person, kind of feeling numb and not really all together. Okay. So something like an atypical antipsychotic, you see here, we know that people suffering from schizophrenia have an excess of dopamine receptors. Remember, it's not excess dopamine, it's excess dopamine receptors. So drugs like clozapine or Clozaril are going to block those receptors for dopamine and serotonin, so that way they can get rid of the symptoms of schizophrenia. Anti-anxiety drugs, kind of the most popular drug here is Xanax and Valium. We talk about GABA. GABA is a neurotransmitter, and what it's going to do is it's going to inhibit your central nervous system. So we know anxiety disorders kind of arouse our central nervous system, our autonomic nervous system as well. So we know that this is going to kind of relax, calm us down, activate that parasympathetic nervous system. Antidepressant drugs, then, we know that sometimes these are being used as anti-anxiety drugs. Drugs like Prozac, Zoloft, and Paxil, these are called SSRIs, or selective serotonin reuptake inhibitors, and they do exactly that. Remember when we talked about, at the end of a neuron, you have the terminal buttons, and they are going to, once they get electrical impulse, they're going to shoot out those neurotransmitters across the synapse. Well, what happens is once the receptors on the receiving dendrites are full, the rest of those neurotransmitters are going to be hanging out in the synapse. So what happens is that reuptake process occurs, like the vacuum process where it vacuums back up all those excess neurotransmitters. Well, antidepressant drugs are going to block that reuptake process, so that way the serotonin can stay in the synapse and make you feel better. Other biomedical therapies not used as much, we have electroconvulsive therapy. This is for severely depressed patients. It's kind of thought of like, almost like a brain, like a brain restart. You think about, when I have a problem with my computer, I just restart my computer. ECT is thought about in the same way in treating depression. Also, psychosurgery. Remember, we watched at the beginning of the year the guy who did the lobotomy, super gross stuff, but that's an example of psychosurgery. Oops. My last slide for FRQ hints isn't there. Interesting. Okay, let me see if it's here. I don't want to restart. Okay. Cool. Okay, so period 7 is the only class that has the FRQ because period 2 had the FRQ for chapter 12. So period 7, you can continue watching right now. So I'm not going to tell you the exact terms you need to know for your FRQs, but the first question is going to be about treatment. So what's going to happen is you are going to have 3 different perspectives. You can probably figure out what they are. And you're going to have, I think it's a total of 6 terms. You have to tell me what those terms are and what perspective they fall under, what perspective is responsible for those specific terms. I mentioned some of them earlier in the video if you paid attention. Question number 2 is going to be about chapter 12, is the commonly confused pairs. So I did mention some of these earlier, but things like borderline personality disorder and bipolar disorder are definitely confused a lot, or DID and schizophrenia. So please make sure you're able to differentiate between these commonly confused pairs. You'll need to explain what they are so I can tell that you know why they are not the same thing. Okay, I think that's it. Please feel free to let me know if you have any questions. Have a great night.